Most, most gracious, kind Heavenly Father, we thank you again for another precious day of life, bountiful of blessings and opportunities with loved ones to share and care for. We ask now that you would be with us during this meeting. Let us open our minds up to the wisdom, to the knowledge that you have given all of us. Give us the patience and understanding, and most importantly, the compassion to love one another and support each other through this time. Amen. Okay, so I've entitled this brief talk, and what I'd like to do is just cover a few things which are level setting for all of us, so that at the end of about 7 to 10 minutes, we're all on the same page, and then answer some questions that were already submitted, and hopefully have time enough to answer any questions that the rest of you might have. And at the end of this, if we have time, I would like to invite anyone who might have suggestions about how we might do this differently or better to please feel free to volunteer or use the chat box, as well as contact Pamela Todd for suggestions. So today's conversation is really going to be focused on these items. We're going to talk a little bit about just sort of background overview of coronavirus to make sure we're on the same page. And then I'll quickly switch gears and talk about transmission and infectivity, as well as the clinical presentation and a little bit about testing. I'll then talk to some degree about the trends in California and Los Angeles, and again, answer some questions. And then importantly, talk about prevention. So what is coronavirus? It's a family of viruses that have been known to be around for decades and decades, and infects both animals and humans. It's named such because corona is a Latin word derived for the word crown. And as you can see in the picture in your upper right, the spikes, the protein spikes on its surface look sort of like a crown. And so it's been given that name. It's an RNA virus, which means that it actually has material and machinery inside of it that can replicate and duplicate itself with the right environment. Coronavirus itself is a part of a family of viruses that also causes the common cold. But this particular type of coronavirus was identified in the end of 2019 in a fish market when a group of people presented with pneumonia. This was in Wuhan, China, a province of Hubei, and this virus was then genetically identified with 2 specific strains that ultimately led to severe respiratory disease. It wasn't until February of this year that the World Health Organization coined the term COVID-19. And it's really just because it's the coronavirus that started in 2019. Many of you may remember the MERS virus and the SARS virus. They are all both part of the coronavirus family. When I try to think back about 2003 and 2012, I can tell you honestly, I don't remember much of the SARS or the MERS coronavirus episodes because they were quite limited. There were things that were peripheral on the news. And when I show you the numbers, you'll see that very few people compared to coronavirus were actually infected. And even though they may have been much more lethal in terms of their case fatality rate, meaning the percent of people who actually died who actually were infected in the first place, they may be much higher than coronavirus. The total number of people was actually quite small. The MERS epidemic was in 2012 and was limited primarily to the Middle East. And the SARS, which actually did occur in other parts of Asia, and actually even in Europe, was actually very, very self-limited. And to date, after that big episode and epidemic, we've only seen a couple of cases around the entire world. So this is just the chart that sort of separates the viruses and again tries to provide a lot of information that hopefully is helpful in differentiating the viruses and sort of putting them in perspective. So first, everyone is familiar with the flu. We get the flu every year, it's seasonal. And I just want to take an opportunity to talk about why the flu doesn't do us much more harm now than what COVID-19 is doing. You have to remember that the flu, back at the turn of the 20th century, proportion of the population killed hundreds of thousands of people. We didn't have a vaccine, we didn't have a way of testing it, and we had no therapy. Now we have obviously a vaccine that we make a good guess every year, and we have lots of people who get vaccinated, and that causes or allows for us to have something called herd immunity. We have an easy way to test it, and testing kits are widely available, so we can make the diagnosis readily. And most importantly, if you happen to get sick, we actually have pretty good treatment for it. In spite of having all of that, each year, somewhere between 25 and 30,000 people die in the United States over a 4-month period of time. So that's a fairly large number of people who die every year of the flu, despite having a vaccine, having very effective ways to make a diagnosis, and having reasonably effective therapy. Now, if we think about that for COVID-19, we actually have almost none of that. We have no effective vaccine currently. We have no effective therapy except for supportive care, and I'll come back to that. And the way to diagnose this, while we do have a reasonable diagnostic pathway for this using nasopharyngeal swabs, these test kits are not widely available, not nearly as available as we do for flu. So this is a big difference between the two of them. And I'll come back a little bit to this, but I think it's important to put this in context, why this is such an important disease. When you put that in the context of SARS and MERS, if you look down at the very bottom, the number of people who are infected by SARS, it was just over 8,000 people total. And the annual infection rate, even in the United States at that time, was actually minimal to none. In MERS, there are 420 cases total globally. So you can see that the natural history and course of both MERS and SARS is extremely different than COVID, even though they are kind of cousin organisms, if you will, with COVID-19 being much more like SARS. And the biggest difference, as I'll talk about, is that both SARS and MERS were extremely symptomatic, and therefore it was easy to identify the cases and separate them, as well as sort of remove them from the population of patients who would get infected. So very, very important. One of the common things that come up all the time is how is coronavirus or COVID-19 spread? And there really are 3 mechanisms. Obviously, we know that it's through the air or by sneezing. Now I'll come back to that. By close personal contact, such as touching or shaking hands. And then through fomite contact or just through touching inanimate objects and surfaces. This is actually really nicely demonstrated in this slide where you can see that one infected individual can actually infect the entire environment by coughing and even talking for that matter. While talking actually may allow virus, just normal talking may allow some of the virus that is shed into the mucosa to be liberated forward. Usually we're talking about a very short distance and very quick dropping to the ground. The running joke on one of our health and temperance calls is that some of the shorter members of our health and temperance team may be at higher risk simply just because they're below some of us who are a little bit taller in the population. So I think it's actually really important to remember that just regular talking, even coughing or sneezing will liberate some virus, but most of it's through droplet, and it should fall to the ground in just several feet. There is some risk that some of the droplets become what we call aerosolized, but they usually are not aerosolized that long and staying sort of at eye level. Again, gravity usually takes care of most of this fairly quickly. The important part of this, however, is that these droplets fall on objects. And this is very important and oftentimes underemphasized. So you have lots of people worrying about wearing a mask, but one of the most important things that you can do is to make sure that you are actually washing and disinfecting surfaces, all sorts of surfaces. There's a really good study that's in JAMA that was published out of China that simply looked at a room of someone who was infected with coronavirus. And they tested every surface they could find. And what they found was that literally every surface, the walls, the interior windows, rails, doorknobs, chairs, almost anything you can imagine had virus on it. When they actually disinfected the room, virus was not detectable. So again, it's really important to recognize that while people are worried about droplets and actually inhaling this, probably a bigger risk of the day-to-day is touching something that has the virus in it, and then touching your nose, your mouth, or even your eyes. Another part of this infectivity discussion is the average number of people that one person might infect. And while measles, for example, and chickenpox has a much higher infectivity rate than coronavirus, which is about 2.5, the reason why coronavirus is so effective is that not only can a person remain infected for a long time, but many people are strongly and heavily infected when they're completely without symptoms, or at least with minimal symptoms. And so it's because people are actually unintentionally infecting people and spreading this disease that we have so many people affected in the United States. We know that that number is getting close to 400,000, and that's probably a severe underestimate because we have such limited testing. And we really are targeting our testing primarily on symptomatic people and not asymptomatic people. So it's very likely, in some estimate, that we already have well over 1 million people infected with this virus. And this is extremely important because for every one person that gets infected, another 2 will get infected. Again, most commonly, unintentionally and indirectly. And you can see how that multiplies very quickly. And this is this whole so-called exponential spread. So again, it's extremely important to remember that the reason why coronavirus is so successful at spreading is because the majority of people who are spreading this disease don't even know they have it or have minimal symptoms. So there is such thing as true asymptomatic shedding. And people who have true asymptomatic shedding literally feel perfectly normal and may sneeze once or twice, or just doing their normal talking, might shed some virus to inanimate objects for which then are touched by someone in the environment who then touches their nose, their mouth, or their eyes. And then there are people who we call mildly asymptomatic. They have mild or minimal symptoms for their purposes because they see on TV people being extremely sick, people being hospitalized. They dismiss their scratchy sore throat, for example. This is particularly true in young people who tend to have milder or minimal symptoms compared to folk who may be a little older or frail. And oftentimes this is dismissed, but what they are actually doing is, again, infecting their environment or infecting other people unintentionally because they're unaware of it. Now, the risk factors, I think most of us have heard about. We know that chronic diseases such as hypertension, diabetes, cancer, kidney disease and kidney failure, as well as other chronic autoimmune diseases, put people at increased risk of getting the disease, as well as increased risk of having complications. Likewise, advanced age has also been noted to be a risk factor. I do want to, however, mention that we are seeing more and more people, particularly in the United States, who are relatively healthy and young, meaning less than 50, and no known chronic diseases. And so I would not simply dismiss that you're healthy and young, and therefore you're not at risk. I know some individuals, one person particularly personally, who was very, very healthy, someone who was an avid exercise person who jogged almost every day, who had no chronic illnesses, who's now dead. And so these are anecdotes, but when you see and hear about them over and over again, the anecdotes turn into data. So again, I think this is really important. Very quickly, the way this virus simply works, this virus attaches through a receptor. It's called the ACE2 receptor. It's on our normal cells. And then it uses the cells basically as a slave to, once inside, to basically re-engineer its material, its RNA material. That RNA material then duplicates itself in a life cycle and produces more viruses, which then simply travel throughout the bloodstream and throughout the individual's body to attach to other cells. Now, in certain cells, particularly in the lung, there are a couple of different types of cells in the lung. When this virus attaches to these cells, these are called type 2 pneumocytes, these cells then are destroyed by the virus itself. And it's really our body's response to the destruction, if you will, that causes such severe reaction. Again, just like so many diseases, even like cancer, it's not the cancer per se that oftentimes is the problem, or the flu virus that's the problem. It's our body's response to it. And in this case, our body's response is so dramatic, particularly in the lungs, that it can cause pneumonia or bronchopneumonia, which is pneumonia that's spread out over multiple lobes. And this can lead to acute respiratory distress syndrome, so-called the SARS virus 2, which is severe acute respiratory syndrome. And this is the pathway for most people who actually are admitted to the hospital and may even require critical care or intensive care unit stay. So this is extremely important to note, and this can actually occur very rapidly in a very short period of time. The median time to developing symptoms for most people is somewhere around 4 or 5 days. But even if you don't have symptoms in 4 or 5 days, it can certainly occur even after 10 to 12 days. With very rare individuals having symptoms after 14 days of exposure. The most common symptoms, as you see there, are fever. And fever is a presenting symptom oftentimes in 60 to 90% of patients, and oftentimes can be the only symptom. Fatigue is very common. Dry cough is more common the case than having a productive cough. Difficulty breathing may be very subtle at first, just feeling a little winded or fatigued, as opposed to having severe shortness of breath. And while you don't necessarily have sneezing, it can happen rarely. Runny nose is very common, as well as sore throat, and even diarrhea. So again, if you look at this chart, so many of these things are very common other illnesses, viral illnesses, that I would consider yourself being at risk, given the frequency of this disease, having any combination of symptoms. The clinical course overall is very, very mild for the majority of people. But in 14% of people, they might actually have severe enough symptoms to stay at home or avoid getting out of bed, for that matter. About 3 to 5% of people will find their cells needing to go to the hospital. And a fraction of those individuals obviously will need to have artificial respiration. Once you have artificial respiration, it's anywhere between 30 to 50% chance that you will die. And again, the reason why this is such a big deal is because of so many people who actually are exposed and the latency, if you will, for developing severe symptoms. If you look at the trends in California, and I will tell you personally, I love the LA Times site. I think they do a good job of providing updated information, so I would recommend people looking at that. You can see that we've actually increased the numbers rapidly. Some of this actually is related to just increased testing availability, but when you look at the actual number of people in the ICU, the number of people who've actually died from this disease, it follows a very similar curve. So this does represent true increases in the number of cases. This slide does a nice job, again, from the same source, LA Times, of tracking the number of new cases per day. And again, we think that our testing strategies and availability have been relatively stable over the last week and a half or so. And you can see that probably every 3 days or so, we have an increase in cases that are announced. The most probably important thing to look at, and it's what public health departments look at, is the number of deaths that we're experiencing a day, with the sort of death doubling time being anywhere between 5 and 7 days. And so that's a really good thing to look at. But it's so important to actually look at charts like this and not pay attention to what happens on 1 day or 2 days, but it's a trend over the week compared to the prior week to let us know whether or not we are really leveling off or not. The most important things that we can do to prevent this is mostly, I think, things that we already know. Avoid close contacts, and this social distancing or physical distancing is extremely important. And when you're out or having to contact somebody, keeping your distance, again, that a minimum of 6 feet is very, very important. The idea of avoiding gatherings and using Zoom like we're using now, or Skype or other things, is extremely important, even for your relatives for that matter. I would assume, and I tell my brother, you're quarantined. Unless I know where you've been for 14 days, you're quarantined. And in fact, we can talk through a window or we can actually Skype. He's actually been really good. He's been off work, but he occasionally goes to Home Depot, etc. And so every time he goes out, as far as I'm concerned, he's been exposed. And if we think about this in a very serious sense, we can actually avoid propagating this disease or getting infected ourselves. Avoiding touching our nose, our eyes, our mouth are extremely important. And this is probably one of the most important benefits of wearing a mask or a scarf, is that it actually just protects you from touching yourself. Washing your hands over and over again is extremely important. I have cracks on my fingers because I use so much hand sanitizer throughout the day at work and even at home. It has become a really, really good habit. So I would just encourage you to have this as a fundamental habit that you do often and thoroughly. And what I would say about the hand washing, this is not a 5-second hand wash. Soap and water works extremely well, but you need to use the soap and water for a minimum of 20 seconds. It's a very effective, very cost-effective way of doing this. But if you only do it for 2 or 3 seconds, you really are not being effective in decreasing the virus on your hands. Protect others. Again, wearing a mask is one way to do that, but please be consistent. I mean, cognizant of your risk to others, because again, there is a risk that you could be easily infected and infecting others. So again, not just thinking about protecting yourself, but protect others. And there's lots of great information at the Department of Public Health website, at the CDC websites, etc. All of this is to flatten the curve. And a lot of you have heard a lot about this. This is so important. And I like this graphic because it does a nice job of basically telling the public what will happen if we do not take these measures. Remember, I said in the very beginning, we have no effective treatments for this. The hydrochloroquine or the Plaquenil, there is no good data at all that this works. None at all. There are anecdotal data that it might work, but there's no good data that Plaquenil or hydrochloroquine really works. All the retrovirals don't work. We have some studies to look at that, but we have no evidence that they work. All we can really do is support you in the best way we can when you get sick, and then let God, Mother Nature, meditation and prayers, and your own body's physiology heal you. So this is why these protective measures are personal, community, environmental sorts of measures that we've talked about are so important. If that's not done, then more people are sick. And the problem with more people being sick is that we just don't have the resources to care for you. So you've seen some of the videos, I'm sure, from Italy where people have just made decisions, I can't intubate you, so you're gonna die. They're doing that already in New York. So this is something that is not just an overseas problem, this is actually happening here in the United States of America, in the Northeast. And I have colleagues of mine who I talked to about some of the horror and the decisions that they're having to make. I was just on a national call yesterday. I can tell you that this is a real problem. So we can do our part by helping ourselves and helping others by taking these protective measures. Again, there's really no other treatment or therapy at this time that's going to prevent ourselves or someone else from getting sick. I'm going to stop there and answer a few questions that were offered by the group, and I'll get to them pretty quickly, and then stick around if people have other questions that they want to submit. Let me just look at the chat box real quick. Okay, good. So is COVID-19 a man-made virus? In the interest of time, I'm going to settle that pretty quickly. No, it is not a man-made virus. I know there's lots of videos out there, lots of people who've put out very what seemingly credible arguments for this. But the COVID-19 virus has been mapped. There are really definitive ways to differentiate biological warfare and manipulated genetically engineered viruses and bacteria from that which is actually mutated naturally in nature in animal host. And so that's actually been done. And there's actually fairly good publications about this as well. Could that all be a sham? Yes. It is possible that there are multiple publications in peer-reviewed journals that are all part of the conspiracy. That's possible. But I think that's unlikely. I think it's much more likely that the conspiracy and the fake news is that of bioterrorism, etc. So Janice asked, let me see that went by too quickly. Was COVID there before its discovery in 2019? So again, COVID, and let's just make sure everyone understands, COVID is sort of a new term used for this particular type of coronavirus. And it's a very specific genetic strain of coronavirus. There are two specific types that have been tracked to this, this outbreak. However, there are hundreds of strains of coronavirus that exist and that have existed that we've known about for decades. So coronavirus is a large family of viruses. And just like SARS, which this is very close to SARS, the coronavirus family and a number of close cousins have been well documented existing long before we even had the capability of doing genetic engineering. So yes, it's a very good question, but coronavirus has been around for quite a while. And then if you have certain mutations, and there are reasons teleologically why viruses and bacteria mutate, some of it's randomly, and sometimes it's a survival advantage. Sometimes it's actually a response to an environmental stimulus. But nonetheless, the jury is in, at least from a scientist standpoint of view, that COVID-19 is not man-made. Why is the incubation period so much longer than the other virus families you mentioned? So the incubation period is 14 days, sort of on the long end, but the median incubation period for this before you become symptomatic. So again, let's define incubation period. It's the time of exposure to the time of developing symptoms. The median incubation period for coronavirus is 4 days, not 14 days. It's 4 days. And when you look at that, just the median time, it's not that different from other viruses. The biggest difference, which makes it sort of odd, is that there's sort of a spectrum of symptoms, right? If you look at MERS and you look at SARS, their symptoms are so severe. So if you get infected and you become symptomatic, it's very obvious. Versus in coronavirus, the symptoms may be unnoticed or dismissed. And so again, if you count all symptoms at the very beginning of this symptomatology, the median time is 4 days, which is actually very similar to a lot of viruses that we talk about. Good question. Is the coronavirus airborne? Yes, it is. Is it airborne just by talking, by coughing, etc.? Sure, it is. But it's actually minimally airborne. The majority of this coronavirus is actually spread by droplets, meaning that even in talking, as I'm talking now, there is such a tiny amount of the virus, which is actually aerosolized by conversation. You have to understand that when you see studies that demonstrate aerosolization, that's what they call it, of this virus, they actually have been done in a sort of controlled laboratory experiment where they're using very highly technically non-reality-based environments. Now, the other part of this is that when you say you can detect something, it doesn't necessarily mean it's the same thing as being infected or infective. So an example, we have data to show that I can detect virus on plastic, say for example, for 6 days. I can detect virus in a room of someone who is sick for up to a month afterwards. Just because you can detect that virus using RNA replication tests, which is called a PCR polymerase chain reaction testing, doesn't mean that that's enough virus to make you sick. So you have to always separate the information that we're getting. Detecting a virus versus that virus being able to make you sick, which is called infective. These are two different things. They're two very different things. And there's a lot more information about being able to detect something that's been published that people unfortunately are reading into that means you can get infected. And that's not the case at all. It takes actually a reasonable amount of virus, whether we're talking about measles, the flu, or even coronavirus, to get sick. And we know this because healthcare workers who've been sick, and the types of healthcare workers who've been sick have been those who've had repeated and prolonged exposures. And so a casual exposure, a simple casual exposure, this is airborne now, just walking by somebody who's talking or breathing and who's shedding is not going to make you sick. There's no evidence that that would make you sick. The numbers in China and the numbers in the US would be drastically different if that were the case. And it would have an infectivity ratio, not of 2.3, but more like measles, if you will, of 10 or 15. So it's a very, very good question. Probably the biggest risk of it becoming airborne is in the environments where you're doing what we call aerosolized procedures, meaning you're actually doing a procedure in the hospital setting or another setting that's sort of a pressurized airway. So it's, again, very, very important to sort of separate that. I always like using the example about what it means to be aerosolized. And I apologize in advance if this is a little too crude. So we know that there are people sometimes who have bad breath, okay, halitosis. And you might be standing 1 or 2 feet or 3 feet away from somebody, and you can smell their breath. Well, that smell is an aerosolized odor, okay? Now, the further away you get from that individual who's talking with bad breath, you can't smell it. And in fact, the aerosolized odor is sensitive to gravity and will go down to the ground and dissipate very quickly, okay? If you, however, stand in front of that person talking over and over and over again, you will continue to breathe and inhale that air, okay? Another good example of thinking about what does it mean to be aerosolized is going to the bathroom or spraying an aerosolized container in your house. The aromatic fragrance is aerosolized, and it stays there and can stay there as long as there's a source, right? The more finely it's aerosolized, the longer it will stay there. For the coronavirus, which is actually between, the particles are between 5 and 10 micrometers, which is small. This is actually larger than what happens when you aerosolize a can of spray for aromatic improvement of the environment. And it's actually even smaller than the odor particles for someone with bad breath. I'm sorry, larger than the odor particles for someone with bad breath. So this 5 to 10 micrometers is actually, even though it's small and you can't see it, it's actually larger than most of the things that we think about and worry about inhaling. So this idea of it being airborne, this idea of talking to somebody and you getting it from them is really not founded from a data-driven standpoint of view, although there are experimental models which suggest that the virus is sort of hanging around. This is why there's no real problem going outside walking. There's no real problem actually going for a run or anything like that. But again, the idea of wearing a mask is to protect you and make you also comfortable, but it's really to protect you and to protect others, particularly if you're coughing, sneezing, or have symptoms. Let me see if there are other questions related to that. Okay. Does wearing a mask and gloves prevent me from getting the coronavirus? There's nothing that can completely prevent you from getting infected. Nothing can completely prevent you from getting infected, except for living alone and staying in the house, or whoever's in the house with you staying in the house, or staying sheltered, if you will, or sheltered in place. Going out and being around other people who may be infected or shedding or interacting with inanimate objects or in the environment is a risk. And so even though it may be small, if you wear a mask and gloves and are continually disinfecting yourself, you cannot erase that risk completely to zero. So I see lots of people who are wearing a mask and they have nothing on their eyes, even in the hospital, even going in to do a procedure. And again, their eyes are not covered. So the mucosa in their eyes and the conjunctiva are a gateway for a virus that may be aerosolized or virus that may be in small droplets getting into them. And so again, think about this. Any mucous membrane, any opening to your interior, your eyes, your nose, your mouth, an open wound or cut is potential access. And the only way you can really minimize that, most people aren't wearing gloves 24/7. Most people don't wear gloves to bed. I can tell you that inadvertently the virus has been found on bed sheets. It's been found on nightstands and anywhere you can imagine. So unless your environment is completely controlled, it's almost impossible to completely rid your environment of viral particles. Having said that, wearing a mask outside is now recommended. And I would strongly encourage that if people have any concerns about that. I think that that's supporting data that may work. Wearing gloves becomes a problem over the long term when people get used to wearing the glove. So again, I've seen people who are wearing the gloves and they're so used to wearing the gloves that they're touching themselves with their gloves on. So you have to be very, very careful even when wearing gloves. Again, the good habit is just good hand hygiene continually and often as a way to prevent this. Okay. The last question that I did have, and you guys can go ahead and begin writing questions in the chat if you'd like, but the last question that I had is coronavirus in the ocean. I guess I wanted to just have people remember that fungus, bacteria, viruses are ubiquitous. They were here and are going to probably outsurvive many species. of animals. And so they are ubiquitous. The question is, can they survive in a living fashion? Because viruses need to survive in a living sort of state in order to infect you. So a dead particle will not infect you. And the coronavirus itself has not been detected. Live virus has not been detected in water, in our water treatment plants, and that's been tested over and over again. I am not aware of anyone doing routine or really good, rigorous testing in large bodies of water, but I would argue that just the vast nature of water and the movement of water would make that a very unlikely source for getting virus. Just the dilution of it alone is enough. But I do think it's a very good question, thinking about where the virus is. And again, it's really about the virus surviving and being alive when it gets to you for it to cause harm. So practical points such as I bring in my mail, and because I know that the mail carrier may or may not have had on gloves, or they may or may not be sick and having some asymptomatic shedding, I take gloves. I go into my mailbox. I take all the mail out with my gloves. I actually go ahead and go through my mail with my gloves. And the stuff that I know I'm going to throw away, I throw away right then and there. The things that I actually know I want to open, I think I want to open, I set aside. And I set aside in a place which I consider, quote unquote, a dirty area. And I set it there for 2 days. Because on paper, I know that the virus doesn't last that long. And because I've intentionally set it aside for 2 days, it turns out it might be 3 or 4 days before I actually open that mail. And that's just a way of ensuring that even if there is virus there, the virus and the viral particles are actually dead. This is akin to taking a Amazon box and taking it and putting it in the garage for a few days or a week before you open it. It's the same sort of idea. There may be virus particles still on the box, but it's dead and can't hurt you. I hope that's useful. So I have a question from Janice Ahana. Does the cold weather, rain, keep the virus airborne or prolong its survival? So that's a really good question. It turns out that it's not just temperature, it's also humidity as well. And we are learning more and more about this. But it is very likely that sort of overcast, cooler weather that's damp probably does add to the longevity of the virus to some degree. But again, the heavier the weather, the more likely gravity will have impact on the virus. So again, it pushes the virus. The more humidity in the air, the colder it is, it's more likely that the virus will be pushed down to the ground. So it's a very good question. And while it does prolong its sort of survival, those same conditions actually act on the virus from a physical standpoint of view and push it down to the ground as opposed to keeping it airborne longer. So very good question. Any other questions? I hear baby.
You're sending your message privately.
Yeah, you might want to mute.
Everyone.
Yes, so let's see, Valerie, I know that's Valerie. I'm gonna mute you, Valerie. Okay, any other questions at all? Okay, so next week, I promise you we'll hold to probably 30 minutes or less There won't be so much overview, and what we do is try to have as much interaction as possible, as opposed to me providing a presentation of sorts. I would like for you all, and I'd solicit from you all, questions or concerns that you might have, either in advance, which is fine, or just be ready on the call with questions that you can put right into the chat. And I'll do my best to answer the questions accurately, or if I don't have the information, get the information for you and provide that for you, either as individuals or in the following week. So I hope that this was useful. There's a ton of information that is out there. There are some really good videos on YouTube with very thoughtful experts and good educators who are talking about everything from pathophysiology to epidemiology, just all sorts of really good things. So I would encourage you to educate yourself in that way. I would, however, say that the information and the information overload is so much that it's also anxiety provoking. And the unknown and the fear potentially of the unknown, the possibilities, is equates to a really bad quality of life. And so I would recommend for people that, log on for 10 minutes and get your update and let that be it. Watch CNN or your news for 10 minutes and let that be it. Don't park yourself in front of TV or stay on the internet looking at all of this information. Most of it will not affect you directly, but indirectly it will actually cause you to have heightened levels of anxiety, frank fear, and it's that sort of inflammation, I might add, the chronic state of sort of anxiety or fear, which will deplete your immune system chronically. And that will give you even a higher risk of infection or complications if you were to get infected. So practice mindfulness, practice the faithfulness that you all have as Christians, practice meditation, but anything that you can to fortify yourselves emotionally and spiritually, so that you can stay informed but not stay overwhelmed. I think there are a couple of other quick questions, but I did want to make sure I got that information in there for you. So if you need to open a package immediately, what do you suggest? So if you need to open the package immediately, Sanjay Gupta recommends sort of wiping it all down, etc. I would say that the easiest thing to do is to get yourself, if you don't already have it, get yourselves a pair of gloves that we would just like to call dirty gloves. It's expensive, and you may not be able to find disposable gloves, latex gloves, for example. But I would recommend getting some cloth gloves or rubber gloves or leather gloves and putting those on. They're considered dirty, if you will. Use that to open the contents, and then you can dump the contents, the inside contents, and wipe the inside contents down. Those dirty gloves you can keep in the garage or keep in what you consider a dirty room. And you can also wash those gloves and reuse those gloves in the I'm sorry, not the dishwasher, but in the laundry. We know that laundry cycles, and particularly a hot dry cycle, will disable and kill the viral particle. So that's what I would do. I think it's actually challenging to use different gloves every time, but I just have a pair of gloves that I use when I get the mail, and they're set aside for that. And I've washed them a couple of times. So that's my recommendation. And then if you have something inside, I would, again, you could keep those gloves off, but remember at some point, the packaging, even inside, may be contaminated. So the nicest thing to do is to be able to clean that if you can, or just simply wait if you can be patient. If you can't, then sort of take away all the external wrapping as you can with the gloves, et cetera, et cetera. And when you get to your product, then do your best to wipe that down or leave it aside if you can for a day or so. It is very likely that the inside product was wrapped and packaged days before you actually received it, and therefore the actual item itself even if it has particles on it, those particles are dead. And again, I would wash my hands before and wash my hands after handling something, okay, just as a habit. Okay, if that brings us